Welcome back to Arab Health Week. I'm Dave Sharp, your host and moderator for today's event. So far, we've had a brilliant morning, fascinating insight from AstraZeneca into the development of the vaccine as the best possible hope for controlling and hopefully ending the pandemic. If you missed that, don't forget you can watch all of our presentations from across the week, yesterday, today and tomorrow on our Future Health YouTube channel. You can just slide along there. There's 4 or 5 hours worth of content to find the presentations. If you're not sure where they are, just refer back to your program, which is available on the website. This brilliant platform that we're on today gives you the opportunity to connect with each other, to network, to share ideas, best practice, etc. And of course, you can chat with each other using that little chat box. For the presentations, you might want to ask a question. So simply use the Q&A. If there's a question there that you want to boost up the rating so that it gets asked, you can vote on questions on this platform as well. But do use that chat to say hello to each other, to network, and to just tell us a little bit about yourselves. The whole idea of this Future Health series of events as we go around the world over the next few months is to build a vibrant, dynamic community of healthcare and health professionals and connect us all so that when we meet again in person next year, we all feel like we're a little bit closer and a little bit more well known to each other. So we're going to get on. If you want to check us out on social media, we're there following the hashtag, which of course is Arab Health Week. We're on all of the social media channels. And so even when today's event ends, you can carry on the conversation. So that's what we're going to do now with our next presentation. We're looking at the issue of consumer-centered care and particularly healthcare app development and non-traditional appointments. To take us through that, I'm proud to announce that we've got the Chief Information Officer with us from Dr. Abdulrahman Al-Mishari Hospital. That is Abdulaziz Alkhlaif, and his presentation follows now.
Good day, everybody. My name is Abdulaziz Alkhlaif, and I'm the Chief Information Officer in Al-Mishari Hospital. Today, I like to share with you some information and a little bit of experience when building the healthcare app. So we're starting with a little bit of background on this actual endeavor, and it's all about how did we think about the objective or the mission that we need to cover with a healthcare application. So by introducing this simple definition inside our facility or inside the team that will work on this endeavor, it helps us align into same objective and clear heading. So our mission or objective is straightforward: to increase the accessible access channel for the customer, mainly patient and healthy individual that we are serving in the hospital, to gain access to the healthcare services, utilizing digital technology to move forward on preventive services in a safe, secure, friendly environment. Then maybe we'll have a little bit of 2 minutes to link or to give you a little background of the hospital that I'm currently operating in, and this application is used and being consumed for over the last period of 1 year and a half. So it's Dr. Abdulrahman Al-Mishari Hospital is a private hospital situated in KSA, Saudi Arabia. Dr. Abdulrahman Al-Mishari Hospital was integrated by back then the government of Riyadh region, His Royal Highness Prince Salman bin Abdulaziz, right now back into 1987. And right now, of course, Prince Salman is the Royal Highness King Salman, the custodian of the Holy Two Mosque. And a little bit of background about the hospital. It's 140 bed with 45 OPD clinics, full operating ER department, 4 OR rooms, and 8 delivery rooms, with all the supporting services department and other ancillary and supporting facility department that is running a hospital. So with this endeavor, we started, working on, the service definition. So we like to utilize something that we know about the current situation or the current services delivered inside the hospital. So we took a concept that is already established in the environment, in the workplace. It's to establish a simple definition of the service and how to move the existing service delivery from the setting of a physical to the virtual. So to ease that concept, we adopted a simple, simulation or equal of concept, saying that teleconsultation is equal to the OPD consultation visits. So that's a simple comparison between the two. So it will guide whomever is working with us on this endeavor to have a clear description what would be included in that encounter. The other side is, of course, the inpatient services will be similar to the home care services. So we're switching those two together in order to make sure that it is clear for the people on the team that will work on this endeavor to be easy for them. Now, for the services definition itself, we identified as a team, as a whole, as a hospital, that we need to deliver certain services in a certain way, in the way that some of those services will be to answer a request or demand from the patient, and the other one is the added value that we will try to push through our application to the patient themselves or the community that we are serving, however different the segmentation or the focus group customer that we may be. So from the beginning, let's start with the one-off encounter. So the one-off encounter is similar to virtual consultation, and we are using that for general check and follow-up mainly. Then also for the refill and adjustment of medication. And of course, for those consultations that do not require physical interaction between the physician or the care provider himself and the patient in the physical setting. Now, to go to the bottom of the list, and you can see it here, it's the one that on subscription base. So similar, as we said, that long engagement, like home care services, so services rendered from nursing, doctor, other healthcare support or healthcare provider like physiotherapy, specialist, respiratory function specialist, and other disciplines that usually deliver those services through physical presence. Now, in the middle, you can see the added value, and this is the whole essence of having those two layers and interaction, and then also having that added channel of accessibility. So we could have that preventive services that we are looking for to move forward from illness management to wellness and to better lifestyle in a sense. That is going to be delivered through establishing education awareness with already people in our setting, in our area, that have that educational background, so they could make those awareness session with the patient. Also, wellness tips, and we will talk about some of those. Where did we take those tips, and what is the way that we establish how could we deliver certain tips for certain people or certain segmentation of those customers that we are dealing with, and then also how did we manage to cater for the different chronic diseases that we catered for the different groups that we deliver services for. These will be much clearer in the use cases that we delivered for, and then some of those activities that has been done, and then analyzed to gather more information and build that baseline that we use to establish and deliver those services. And now, when are we talking about hardware or the setup? Let's we'll go for all of those activities that have been done over this endeavor. And here I like to point out a little bit about the hardware and software. From the start, we established that going cloud base is a good decision to make, as this type of software or solution live like 80% of the time they are living on the public internet. So we want to cater for those endpoint or the public the access from the patient or the individual that will gain access to our services. So the decision was made to have a cloud server. It's hosted locally in the region here to cover certain regulation from the government that any server that need to be deployed locally. So we chose a private cloud, and we deployed on it. So it will be easier to connect to the public offering that we're going to have through deployment on Android and iOS. So other customer, patient who have access through it with no problem, with no issue related to security, and through our own network, our own infrastructure in the hospital. And when we are connecting our internal resources or our internal team, we're using this setup here. You could see that the call center is connected, a call center agent are connected through a full-fledged workstation that have multiple screens, so they could manage the session of care to coordinate between the patient, the doctor, and other information related to recording all of those data points that we are collecting about the patient, enter it in the correct place, whether it is inside the AMR or other related information to facilitate this encounter. And then when we are dealing with the care provider or doctors, nurses inside our OPD, or even in the other area, we're having a station dedicated for that activities that is marked with that this is for virtual health care, and clinician or other care provider could have access to them for that particular incident or encounter, and then deliver the care to the intended customer. Now, also we have people on the move. People are mobile in a sense that they need to move from one area of in the hospital to another, or maybe outside into part of the team of the healthcare team that usually respond to calls. Calls that will be delivered the services on the home service side. So those guys will have a tablet that is equipped with the same application, but identify as a care provider. that care provider could have high elevated authority to access certain features on the application side, and then manage the communication, manage the session, and then also deliver the service in a good manner. That capability also was used and utilized in the use case that I will choose. I'll share with you in the next slide. Okay, so to make it simple, we in the the team itself chose to have a very minimalistic layout for the application. So it will reduce and it will make the use of the application itself is very simple in a way that doesn't require a lot of training. It's have a simple interface that have like the branding of the hospital, the general information that you don't need to interact with, and then at the bottom you have that simple tab or button layout that you could interact with. It's simple and easy to navigate, so there is no much of the usual application size that you have hidden stuff. Everything that the patient or the customer need to interact with is in front of his screen. He doesn't need to navigate away from it. And to share here is that there is no booking appointment available in the first phase. It is available in the second page, but the actual approach for this application is beyond the booking of the appointment. It's actually, once established this engagement or this relationship between us and the patient, we are only a one click away. So our agent in the call center are available for the duration of the operating hours, so they could respond either for a direct call, for if this patient have a known care provider team, they are handling their case, so they could directly connect to them, or they could issue an alert request that will be picked up from a centralized location and then routed or actually assisted in the first line. Is it an emergency case? Does it need like looking after right now? And then dispatch, if it needed, the ambulance, or even go to home care or other facilities. So the care coordinator or the actual agent in the call center will make sure that the patient is engaged and then facilitated the services for them as a healthcare coordinator. Yes. So in for the team itself, so from the beginning, the hospital and the vision of the move forward on this endeavor, it was decided that to organize the project and the program in the same time. So it is a running project with a program as assigned to it. We will move and improve as we go along. So we established multiple teams to look after different aspects of the actual endeavor. So of course, the top layer team is the steering committee or the steering team. The steering team is all about making decision, setting objective, and making sure that it is progress as part of other adjustment of this heading. So we know that achieving our objective is a moving target. So we keep on improving those objectives, maybe move away from an objective that we thought that or agreed on that it is no longer our target, and then deciding and make a decision to adjust our heading. For the operation team, it is the critical team for this endeavor, as they are aware about the activities and they are interacting with the patient, adjusting the daily activity in a sense that they build their action plan, and the action plan as a definition, it's the script that they usually use to interact with the patient going through the virtual health setting. They are in everyday adjustment period, so they will use those action plan as a standard and then try to improve on it from more than yeah, the side of improvement of known issues, known services or other aspect that was not covered in the original action plan, and it will be adjusted and deployed and then used, and that improvement will be continuous. The other team is also very critical here is the clinical team. These guys are usually a healthcare professional, either doctors or nurses or educators. They are, their job is to make sure that the classification of the patient are done in the proper way, so they could identify that these guys belong to chronic disease, or these guys need to be established daily activity, daily encounter and checkup, and other related to establish the clinical pathway that need to be addressed. If there is certain questionnaire or data gathering that it will be established from those particular patient, they will be the one pushing the notification to fill these information back from the customer. If that customer belong to a long subscription or long encounter, long relationship, if they need to look after that patient health well-being, and then also establish that wellness education and awareness about that particular disease or situation, whether it is after certain pre-op or post-surgery situation. Now, marketing team usually is defined by that marketing material, campaign, and other awareness to the general public, or also inside the facility, so we could have those material that explain the way to move forward. How is that care setting has been changed with this introduction of this type of service as virtual health care. So they are putting those packages for campaign, and also the material that will be shared internally and externally. At the bottom, you can see technical team, and those will be, of course, in charge of the infrastructure and other facility related to the technology and the digital platform. They are constantly meeting as well and making sure that everything is running according to the need for it, and so forth. So if we go to the next slide, please. Now, I talked about the use cases that we encounter. We use this technology and use this infrastructure to deliver. And I'll share with you several use cases that we establish, and we try to use these, and we gain some knowledge to push on to the next use case, and so forth. So I said that it was established, and we started this endeavor back in 2020. So we were able to use that this technology to deliver the refill services for the medication in the COVID time. And in a sense that it was a relief for our customer to get engaged to us, so they could get their medication. Of course, we establish a service chain behind this encounter for virtual health, that after the ordering from the in charge physician with this patient, they could process the actual ordering of the medication, and then we will deliver those medication to the patient home. Those was the time when there was lockdown. So that was really added value from the hospital side, so we could serve our customer in that manner, so they could, their health cannot be would not be suffering for that period with the lockdown. So that was a good experience from our side. It does give us some insight of how could we link those two aspects of virtual, activities and then physical activities in the real environment to see those difficulty challenges that we encounter when we are delivering those services. It did have a huge impact. The team have learned a lot in that period, and then we chose to go into another use case. This use case is using the application and the platform to monitor dialysis patient that are that after the that period have ended, and we began to receive patient in the hospital. The dialysis patient have came back, and actually from that period they were coming back with special permission to take the services here. But between the time that session, usually the dialysis patient have 3 to 4 sessions a week, and between that time it did have an impact that our own dialysis nurses have the ability to establish communication between the patient at home. So they could push a little bit of a questionnaire, small answer, how do you feel, what are this measurement for such and such. Then we establish, having that relationship that yes, you are not in the hospital, but we're still trying to get in contact with you. We are establishing the call. It's not the other way around. And that also gained from our side, the team have gained a lot of information. It did have an impact for those patient chosen to be part of that program as a pilot. It was really of benefit for the patient and the team. The other side, once we establish, a little bit of baseline, so we know that we could collect information, segregate people and patient into different category. We looked at how could we derive some impact internally inside the facility itself. So as a direction from the management of the hospital, they chose to deliver the staff healthcare services through the same platform, as it is also a control group, and we could do more of research and gathering information. So we start with a simple questionnaire. It is a detailed questionnaire for all the staff to fill, so they could establish a baseline for their health, overall health. It's related to any lifestyle that they are involved in, and it will explain if they are a smoker, if they have, with their weight and height, so the BMI could be collected, so they could measure that they are within, a BMI range. They are susceptible to certain risk factor. And all of those questionnaire has been given to the clinical team, and they have established certain grouping for the staffing inside the organization. So we could deliver awareness and almost like clinical management, chronic disease management in a way, but in a more productive for the internal staff of the hospital. In that manner, it's also delivered a little bit of knowledge and lesson learned for us. We learned from it, we improved, and we try to move to the next level of following up. That also pushed to establish certain willingness that we could have more services deployed over this platform and this application. Lately, the system is right now used to follow up and monitor COVID patient at home for the entire period of this quarantine at home. And also within that time is established if there is a need to dispatch a team from the home healthcare, that will be done. If there is an emergency, God forbid, that also could be handled. So all of those cases are used for in handling and monitoring illness. The other side, or the last use case, was used for wellness program. So for the staff, it was established that for those segment of staff that are suffering from hypertension or diabetes or other respiratory diseases, they establish a little bit of awareness program, wellness program, look after these certain criteria, try to adjust lifestyle so you could achieve a higher level of wellness. The mother and child program is a newly established program that it will be running in the next period, so that we'll try to onboard potential pregnant ladies, and then we will go through different stages of awareness and engagement between the hospital and the potential mother-to-be. Then not only before the antenatal period and within the antenatal period, and also post-antenatal, as to look after the whole cycle of this situation the mother and child will be in. So I think that is the conclusion of the whole presentation in a sense. The last slide is all about the takeaway. If I could go to the last slide. Okay, the last slide is key concept and takeaways, and I like to give you those to take with you as you end this presentation. It's like when you concentrate on dedicated resources for technology, usually something is missed from the human resources side. It is as critical for any program application to have dedicated technology resources as it is for human resources that dedicated for this project and program. This will quicken the response. It will make sure that the lesson learned is not lost and you don't need to repeat those activities that you already established and you already have gone through. The other thing is that services need to be established in the most simplest way, and then add more detail and comprehensive services on top of that, so you could move and improve and grow as you go along. The third one is, of course, allow changes and growth and maturity for the project along the way for the team and the different functionality and services that need to be delivered. Having a water flow approach as a project is not going to be a a good fit for this type of application or project. It's that continuous circle of improvement, adjust and then release, adjust and release. It is that way of it will improve your moving along to that. Now, the fourth one is, of course, share the scope of service intended for this program for every new member. Because, of course, along the way, new members will join that project and they will come with their own experience of what does, an application should have. And without establishing that these are our objective, these are our scope, or this is where our arena is, it will, cater for a debate once, twice, and more. You remember, and this fifth point is that remember that appointment booking is only the entry point for getting the service. It's not by all means the objective of it. So we don't have an application to get appointment. Appointment is just the first step of that, and it could be replaced with other stuff. So the objective is, of course, to transfer or to change that encounter, the way to deliver healthcare services into more, safe, affordable, accessible, friendly one. That is the ultimate goal. And that's the last point that I want as a takeaway. So for the last slide, I just like to thank you for taking the time to listening to my presentation. If there is any question, and I like to share also my contact with you. Thank you very much.
And I'm delighted to say that Abdulaziz joins us now. He's in Saudi Arabia. I hope you don't mind me telling people where you are. I'm sitting here in the UK. We're going to have a little chat. There have been plenty of questions, as you can probably imagine. You and I were chatting just before we came on air about the development of this technology, and you said a very curious thing. You said patients don't need to see the doctor needs to see the patient. And so many times people try to book appointments, they feel like they physically need to turn up to the clinic, to the surgery, and this new technology, or this technology that is now being made available, means that a lot of the time people don't need to do that. That's got to be a good thing for consumers and for the healthcare industry.
Sure. I think our own thinking of deploying and delivering the service need to be altered with the time. And so we need to be geared up to deliver that type of service in the new packages that really demand it. It's no longer about having the accessibility physically to the patient only, but we could deliver some of those health benefit services without the encounter in physical form.
And that really has become a laser focused issue during the COVID-19 pandemic, hasn't it? Where certainly in many countries, if not all countries, people were actually refused the opportunity to go into hospitals, to go to see their doctors. That wasn't happening because we didn't understand enough about the spread of the disease. And I had a conversation over the telephone with my own doctor, and you were absolutely right. There was no reason for me to actually need to go there. And presumably this will move on quite rapidly, where analysis of symptoms and chat about potential solutions will all take place virtually.
That's absolutely correct. And this is, you need to take a lesson from the experience that we have with COVID. We will only grow as much as the patient or the customer will let us grow. So if they adopt that technology, if they are ready for it, then we could move on it and then we could improve it. And as you can see in my presentation, it's all about that maturity with your own people, with your own technology, and then addressing that service or need for the consumer or the patient or customer.
And of course, we're talking about the app there, and we'll come back to that. But you and I, we're getting very carried away about the potential. And you pointed to the fact that you're wearing a smart watch, which is monitoring some of your activity and health. Do you see a time where maybe, let's say I connect with the doctor and the doctor said, OK, let me just analyze your data. You're wearing your watch. Yeah, I can see that your blood pressure's low or that your heart rate is high. Is that going to happen?
I think it is within our predicted future that those technology will emerge into a new way of those delivering the services that we are looking for. Again, healthcare is for health wellness. It's not for disease management. It's not prevention of diseases. It's going to, at least those are there, of course, established. But in the long run, we could see that this technology will evolve into something that will give us our, just-in-time information to help us make the decision in life that will increase our wellness, our well-being. And if the situation, as you said, you have your encounter with a doctor over the telephone or virtual present, and then he could analyze the collected data for your profile, and he have the baseline of your DNA, the latest test that you have, and your activities for the last month or last week, or even for the day. Pretty much, he could make that decision. What is right now happening with you? Are you on the right track of healthcare? Are you need to adjust your behaviors or habits? And then also give you some heads up. You might feel sort of that symptom or the other, because those behavior lead up to that diagnosis or prediction of intended risk that you will go through. I think this is coming in our future, whether we like it or not. I think it will be a great addition for our well-being. We will be looked after. Everybody is busy with their own life. It's good to have somebody looking at your everyday activities, of course, in a secure, confidential way, in the way that we like to handle those information, as usually being handled in healthcare. But that additional assurance that somebody could help me, somebody could take care of me, somebody could guide me for a better behavior, better social life, better socially active life. That is a good indicator of that bright future, inshallah.
Well, we say, don't we, prevention is better than cure, and too often we go to the doctor because we got ill, and then the doctor says, well, of course, you could do with losing some weight, or maybe you need to move around more. But of course, if we're getting alerts before then, and there are apps available that do that say, you're not drinking enough water today, or you haven't taken enough steps. Sure. That's certainly on the horizon. You mentioned there the app and data. Let's look at two things. First of all, obviously society needs to move to accept this technology. You were saying to me earlier that technology actually has existed for quite a while. Society needs to catch up. It's not the other way around, which might surprise people. What's the take-up, certainly in the Middle East, the UAE, of people getting this technology either on a smart device or a telephone or wherever they can access it? Are people accepting it now?
I think it is widely accepted for the meantime. I think it will be more accepted in the coming period. As you said, the technology itself for telemedicine was existing farther than 10 years. It was there. We did some practice run that we like to deploy. Maybe, as we discussed earlier, that the infrastructure might be lacking that time, but we did, with those programs, invested in dedicated infrastructure, and we tried to roll out those telemedicine capability to cover a rare area, and then also to improve on it, so they will have a program aligned with it, so they will have the communication or follow up on the phone itself. But as you said, society usually derive those type of services to be adopted. As any technologist knows that you will have the early adopters, and then you'll have those people that are ahead of the pack that already know about those technology and so forth. But also the majority of the consumer will be relentless to use the technology until it is proven or they have no other way to go around it and they have to adopt it. It's the introduction of the smartphone, those small devices right now in the hand and pocket of everybody. This is one of the greatest enablers for this technology. Having and adopting new technology is not the common way for the general public, but you could see with this pandemic, they accelerated a lot of innovation to be, very precise for that field, for telemedicine and virtual medicine as well.
Well, certainly getting my elderly father to get a smartphone would be a big challenge. He's still learning how to turn the telly on and off. So there are some challenges with perhaps older populations, maybe populations who perhaps are fearful. Let's talk about that just for the final minute or so. Data protection. Not only is there perhaps a risk that people's data would be stolen by cyber criminals, but also that the technology could be hacked and information sent to people that is incorrect to spread fear and maybe to take control of populations.
That's already a concern, and it should be a concern of one of the top concern of any service provider using the technology to deliver their services. Choosing the right deployment might reduce that attack surface that we are given those attackers or hackers or people that want to hijack this technology for a bad use. I think, as I said, it's picking the right technology, reducing that attack surface is one of the key aspect of moving ahead on utilizing more of the technology itself. Other than that, I think the talk about protection security will take a long time and discussion to cover.
Well, we've hit the final 0 on our countdown clock, but I'm going to be a little bit naughty. I'm going to ask you one more question because I'm fascinated, and this has been asked as well by our audience. You mentioned there about the technology has existed for about 10 years. As an information officer that you probably now can predict the future for us. If we were having this conversation in 10 years' time, would I indeed be talking to you, or would it all be artificial intelligence? How is this going to pan out? What's going to happen in 10 years' time? What can we expect?
Well, I could tell you my prediction of the future. I think it is going to be a positive one. We will have our human interaction, me and you. Our technology will support us in huge way. The introduction of machine learning, artificial intelligence, and IoT of all things. It's going to make sure that we will be aware about our situation. We will be guided for the best decision that we could make out of the information that we have already collected and medicated, aggregated, and then put into visualization for us to really consume and make the right decision about it. I think that the future that we are holding, we will be aware about our surrounding. We will be keen of how to make that decision and making the right decision 90% of the time, inshallah.
Wow. I think if I was having a dinner party, I'd have you on my guest list. It'd be fascinating to continue talking to you about what we can expect and the progress. I mean, I mentioned my 92-year-old father. The progress just in his lifetime in healthcare and technology is unbelievable. So exciting times ahead. It's been great to hear from you. Thank you so much for your insightful presentation. And I wish you a very happy rest of the day. Thank you for joining us.
Thank you. Have a great day ahead of you. Thank you.